Go through a few objectives. What is telemedicine? Why is it needed in arrhythmia and heart failure management? Where should it be used and how should it be used and who should be involved in terms of patients and healthcare providers? As you know, the digital health is defined by WHO as a broad term that includes e-health, advanced computing science, big data, genomic, and artificial intelligence. The e-health per se is defined as the use of information and communication technology in support of health and health-related fields. Digital health, e-health, you have also medical and public health, telehealth, which is the delivery of care services between patients and healthcare providers using smart devices, and teleconsultation is the communication between healthcare providers, and also remote monitoring, which is the most interesting part, that you can use patients' data in terms of follow-up and managing patients remotely. And this telemedicine has multiple benefits. It can facilitate the patient's access to their healthcare centers. It improves their remote monitoring, continuity of care while they're at home, encourages patients on self-care and more awareness of their symptoms and disease progression, improves communication between patient and healthcare providers, and it can easily involve the multiple disciplinary team in their care. As you know, the role of telemedicine was not very known. It was limited to either home monitoring at a very small percentage. But now that there's big awareness of telemedicine, and it has been involved not just in home monitoring of patients with self-care and vital monitoring, but also it's assessed in patients' audiovisual communication with patients and healthcare providers in terms of virtual clinic, home monitoring. You can even triage patients who need to be seen urgently or need to be referred to ED. You can also help them in discharge planning if you involve them on discharge, especially for chronic patients who need close monitoring or early visit, which can kind of be difficult in physical availability of appointments. And now also tele-rehab, that you can encourage patients on exercise scheduling, diet counseling, smoking cessation, education, and psychosocial counseling. So there are many roles in telemedicine can be provided for patients, for cardiovascular patients in general. So why do we need it? As you see in this gray area, you have the patients at higher risk of readmission and worsening heart failure. And this telemedicine and remote monitoring of patient can help in early detection of early signs of decompensation and congestion. It can reduce the patient risk for hospitalization. It can help them adhere to their medication. It helps them counseling and education, and encourage patients to participate in self-care. And thus, we can prevent their hospitalization and decompensation episodes. So a meta-analysis actually had proven that telemedicine use in patients with chronic heart failure can reduce all-cause mortality by 20% and heart failure hospitalization by 37%. And there are many forms of telemedicine, and you can tailor it to your needs and your patient needs. For patients with heart failure, for example, we can provide blood pressure and heart rate monitor, pulse oximetry, weighing scale, home wearable ECG devices, watch for physical activity monitoring, and application with the daily symptom checker. For healthcare providers, also they can monitor patients through their dashboard. They can get a smart alert for the preset vital threshold, and they can do audiovisual counseling for the patient to intervene on their symptoms before they end up being hospitalized. And the telemedicine should be used in centers where they have advanced or well-established disease management programs for heart failure, the facility which can have an outpatient monitoring setup, structured telephone support, and teaching for education and teaching for self-care. This is an example of devices that can be provided to patients, a smartwatch that can monitor the saturation, heart rate, possible ECG lead as well, and physical activity level, a wearable ECG device on the left side of the screen that can be provided to select patient with progressive arrhythmias, and the vital sign monitors, weighing scale that's very important for heart failure patients. The telemedicine solution we are providing the patient has a smart daily check-in system that reminds the patient to register their symptoms daily. It can ask these patients the degree of their symptoms. They can tell us if they have symptoms. They can tell us what grade of symptoms they have. We also teach them how to self-monitor themselves for edema and volume overload. And it's an interactive solution, so patients are getting also warning about their heart failure symptoms if they need to call us or they need to go to ER based on what vitals thresholds they get. And from our side, the dashboard will show us the patient vital signs, how are they. If the patient has within normal blood pressure, or you are having ups and downs of blood pressure, ups and downs of weight change, you can get an alert. If the patient has abnormal hypertension or hypotension, you can get alerts in the red, so you know which patients need your attention more urgently. In a busy service of heart failure in our center, where we look after almost more than 2,800 patients, both with the regular clinic visit, we can actually enroll these patients, and we have been enrolling these patients progressively to monitor them both in inpatient and outpatient. And we have a very strict selection criteria for patients who are actually symptomatic, newly diagnosed. They need frequent clinic visit, frequent optimization of medical therapy. And the numbers of alerts we are getting are usually, it's mainly 90% of them are related to abnormal vital signs, tachycardia, hypertension. And these patients, we actually call them for optimizing medical therapy over the phone. And we have reduced the regular clinic follow-up visit by 40% because all these visits have been converted to telemedicine visit, where we can intervene on symptoms, we can optimize medical therapy without the patient needing to come to the hospital physically, because we already have all the information we need in terms of vital signs and symptoms. And so far, based on the patients we've enrolled, we have reduced the readmission rate down to only 6% of all the patients being followed on the telemedicine service, compared to 35% as a benchmark. So these facilities can help in early intervention of worsening heart failure symptoms. So you are reducing ED visits or admission or a walk-in clinic visits even. You can assess response to treatment while being monitored at home. And you can do very good virtual medication titration. And you can schedule a telemedicine virtual visit whenever the patient is needed, and thus you reduce the routine clinic visit. The same applies as well for arrhythmia. So as you know, arrhythmia and heart failure go hand in hand, and most of our patients, they actually have ICDs and CRT, and we can actually utilize this in managing of heart failure and monitoring their arrhythmias. And given the numbers of patients that have been receiving ICDs, which is in thousands, and we have seen a very good reduction in routine clinic visit when we are doing virtual follow-up in device clinic for these patients. So thus you are reducing unnecessary hospital visits for patients, and thus you're also keeping a good monitoring of patients' symptoms, their arrhythmias, and also there are smart solutions that can help in ICD devices that can actually help you detect if the patient is decompensating or not. So as you can see, there is actually 50% reduction there's a 50% reduction in actual clinic visit for device follow-up compared to device monitoring for patients with ICDs or arrhythmias virtually, which is clearly unloading a lot the healthcare system, and also helps in intervening on symptoms more urgently. So the early intervention for arrhythmia and shocks can be assessed through remote monitoring, and also the assess to response to treatment while the patient at home. And this is very important in reducing, again, admissions and reducing routine visits, which can be done also virtually. So the most important thing that we have to think about before expanding these technologies, that the data security, data accuracy, we have to check frequently if the data we're receiving from these remote monitoring devices are accurate or not. And do we have real-time access to data that we are not seeing them late, we are seeing them actually while the patients are sending them. How can we integrate different systems together into the patient's EMR and have all the data available in one system, and cost of all services, which is balanced by reducing the cost of hospitalization and hospital visit. So in conclusion, there is a combined conventional and digital approach that should be considered in heart failure program. or in cardiovascular programs in general. And there is a need for digital health, which has been more acceptable in the recent times. And we need to grow our experience in this field of telemedicine to develop more reliable, affordable, and user-friendly methods for managing patients. Thank you.